So to find an up-to-date copy of your timetable, you go to Blackboard homepage, we're going into student area, and then on the left-hand side menu you click on course information. In course information you'll be able to find the most up-to-date copy of the timetable. In semester 1 your modules will include biomedical science and oral biology, behavioural sciences and clinical practice 1. So the timetable. The course uses a blended learning approach, and so the materials delivered by way of lectures, face-to-face, chat room, discussion boards and SDL. Most of your lectures will be held in the tutorial rooms, and depending on who is leading the lecture will depend on which site they are based. The rest of the students will join in via VC or video conferencing, so that you all receive the same information at the same time. Chat rooms and discussion boards are found on Blackboard. Again, another way of delivering the information. Chat rooms, you all join at the same time. You can be in different locations, that doesn't matter. And effectively, you're offering your ideas, suggestions and possibly analysis in a real-time situation. Discussion boards are slightly different. You can still offer and put together your thoughts and ideas, however this isn't necessarily done in one session and will be done over maybe a few sessions, weeks, depending on who's delivering the information and what you want to get out of it. SDL stands for self-directed learning. This is one of the crucial parts of the course. You'll often be given SDL, self-directed learning, before you are due to have a lecture. The whole point is that you get all the information, all the background information that's relevant for that lecture, so that you all make the most out of it. I can't stress enough that SDL is essential for you and your colleagues to get the most out of any lectures. So the course composite. The course is delivered either from the CRS, which is the clinical skills room, or you may be on clinic, or you could be in the lecture room or tutorial rooms. We also see the timings. We do a morning session, have a lunch break, and then an afternoon session. The times here are your start times, 9 AM and 1:30. This is when the lecture or clinical starts. Therefore, it's important that you're there earlier and prepared to make that start at those times. So if you've got a 9 o'clock clinic, you should be on clinic and setting up at the latest by 8:45. Similarly, if you've got a lecture at 1:30, you should be there at least 10 minutes before at 1:20, ready to start at 1:30 for your lecture. Finishing times can be a guideline. You might finish earlier or you might finish slightly later. These are not set in stone and there is, to a certain extent, flexibility. As already mentioned, your modules for semester 1 are biomedical science and oral biology, which you can see in the timetable is going to be in the purple print. You'll also be on clinical practice 1. You can see here CSR means that's going to be in the clinical skills room. That will be timetabled in a blue print. And finally in semester 1 you've got behavioural sciences, which is in an orange print, just to help you when you're going through the timetable to determine which of the modules is which. So this is your timetable. You can see this is semester 1, week 1, Monday the 3rd of September, and this is year 1, year 2 and year 3. You can also see the lectures that are going to be delivered, or the clinics, and the tutor responsible for delivering or supervising that area. So if we go to Monday the 3rd of September and to the afternoon, you can see that Carol Armstrong is going to be delivering cell structures, organelles, cell division and genetics with the learning outcome 1.2.11. The learning outcome number is essential to coordinate and find the learning resources associated with any of the material on Blackboard. It's up to Carol Armstrong how this information is delivered. It may be put as face-to-face, it may be set as SDL, or some other method. For example, if SDL is set, normally there would be an announcement on Blackboard, and then you will find the SDL again on Blackboard, and normally between 10 to 14 days to make sure that you have time to get the information, do the readings and the work prior to any lectures that are given. So if we go down now to Thursday the 6th of September, you can see the first years in the morning session you're due to be in clinical skills, and this is going to be an introduction to the care of your phantom heads and the seating position. You can see here 3 tutors are allocated: Gillian Marshall for Dumfries, Lizzie Hall for Stornoway and Leah Fraser for Inverness. Moving down again, on Monday the 10th of September in the afternoon, the student advisor meeting intro. At certain times during the course you will have student advisor meetings, and these are essential. These will cover pastoral and academic work and are compulsory. Moving on again, your assessments for all your areas will also be marked on the timetable. So for example, on the 20th of September, you can see in the afternoon you have a formal exam, an OSCE. An OSCE is an observed, structured clinical exam, and on this occasion it's going to be your CPR. Other types of assessment, if we move on to the 24th of October, you can see here on the 24th of October another formal assessment, BMS, so that's biomedical science. It's a long answer question and it's an online submission and it's due by 5 p.m. All the information for assessments and guidelines for OSCEs, all of that information is found on Blackboard.